I'm Dr. Saif Al-Sahi. Today's presentation is on surgical anatomy of the breast. It's at postgraduate level, surgical training level, FRCS level. It's sponsored by ISEN and CME Iraq Medical Education. Why is anatomy of the breast important? Due to current development in aesthetic breast surgery and oncoplastic breast surgery, knowledge of the blood supply, nerve supply, and anatomy of the breast is crucial for the best outcome. Also, understanding lymphatic drainage, venous drainage of the breast is important to understand metastasis of breast cancer. Blood supply to the breast might vary between individuals. However, the main four blood vessels that contribute to blood supply to the breast are internal thoracic artery, lateral thoracic artery, thoracoacromial artery, and perforators from the lateral intercostal arteries. Other blood vessels of the chest wall participate in blood supply to the breast, but to a variable extent. Internal thoracic artery, also known as the internal mammary artery. It's a branch of the subclavian artery. It runs within the chest and it's crossed by the phrenic nerve. It runs along the attachment of the rib to the sternum around 1 to 2 centimeter lateral. In each intercostal space, it gives two branches. It supplies the medial and inferomedial quadrant of the breast. At the level of the sixth intercostal space, it will divide into two terminal branches, the superficial epigastric artery and the musculophrenic artery. Thoracoacromial artery is a branch of the median section of the axillary artery. It has four branches. This artery forms extensive communication with other arteries as the internal thoracic artery, the lateral thoracic artery, and the intercostal arteries. It's considered the main blood supply to the tail of the breast, tail of Spencer. Lateral thoracic artery. It starts under the pectoralis minor muscle and it crosses the ulnar nerve and axillary vein. It gives multiple branches from the level of the second to the fifth intercostal spaces. It supplies the breast by perforating the pectoralis major muscle and give blood supply to the mammary glands from underneath toward the skin. Other important element in blood supply to the breast is the arterial plexus. Arterial plexus are formed by communication between the blood vessels supplying the breast. There are three main plexus. The subdermal plexus that forms an extensive network of blood vessels under the skin toward the nipple. The second is the preglandular plexus that runs in the fatty tissue surrounding the glandular tissue of the breast. It sends branches through the fascia and lobules ducts to supply the glandular tissue of the breast. The third is the retroglandular plexus that runs from the intercostal and chest muscle wall, perforate the muscles through the breast tissue toward the nipple. These plexes are of less significance during surgery. For surgical purposes, nipple areolar blood supply has been divided into five anatomical types: medial, lateral, central, inferior, and superior. Some patients have blood supply from one type only. Others have multiple types blood supply to the nipple areolar complex. This is significant for blood supply to the nipple areolar complex during breast surgery. Summarizing blood supply to the breast, it has four main arteries plus blood supply from other chest wall arteries. The main arteries are the internal thoracic artery, the thoracoacromion artery, the lateral thoracic artery, and perforator branch from the lateral cutaneous arteries, in addition to plexus that supply the breast and the nipple areolar complex. Venous drainage of the breast. The main route of venous drainage of the breast is the axillary vein. Veins from the breast drain by two routes. Superficial route that form plexus under the nipple areolar complex and drains mainly into the internal thoracic vein, and superficial veins of the lower part of the neck. Deep veins that follow the arteries and go deeper to the superficial fascia. These drain mainly to the internal thoracic vein and the axillary vein. Breast cancer metastasized to the bone. That follows venous route. As the internal thoracic vein drains the breast, it drains to the azygos vein, and the azygos vein has communication with the Patson plexus in the vertebrae. These connections are valveless, which might allow malignant cells to spread from the venous drainage to the spine and form deposit of cancers and metastasis to the vertebrae. Some confusion is sometimes the internal thoracic artery called the internal mammary artery. Blood supply might be asymmetrical in both sides. However, in 96% of patients, the blood supply is symmetrical.